as COVID-19 raised its spectre, threatening the world in January 2020. The Government of India, under the able leadership of the Honorable Prime Minister Shri Narendra Modi, moved swiftly and with determination to tackle it. Much before WHO had flagged COVID-19 as a public health emergency, or India had reported its first case,
This is big breaking news coming.
India had already started surveillance for incoming international passengers at airports to restrict the influx of infected patients. Working further on PM Modi's vision of whole-of-government approach in March 2020, 11 interministerial empowered groups were set up to coordinate all facets of the pandemic management. As India geared up to tackle COVID-19, another pressing need was felt.
As the COVID-19 cases started increasing in our country in 2020, we realized that we need to not only collect data but also aggregate this data which was coming from different states, different UTs, and then analyze that data promptly. And based on this collection, aggregation, analysis, public health decisions need to be taken in real time. So it was in this context that the idea of a COVID-19 control room came into being.
The need was clear, and the Government of India moved in a focused and timely manner to address it. The Ministry of Health and Family Welfare took steps to establish the COVID Command and Control Room as a single window approach towards data-driven insights into COVID-19. As the pandemic started to evolve, so did the control room. From being a means of data aggregation and analysis, it metamorphosed into an essential asset for policymakers by undertaking detailed surveillance and reporting at the national, state and district levels, and played a crucial advisory role by giving critical inputs based on analysis of large data sets to aid policy and decision making.
Since the early days, the COVID control room was a huge asset. We got an overview of the entire country. We could see what was happening and where. This allowed us to respond faster and identify activities to control the surge in cases before it went out of control.
In an infectious disease, no one is safe till everyone is safe. Collation of data from all districts was thus crucial in understanding COVID-19 trajectory areas across the country and also COVID challenges. Another benefit of the COVID Command and Control Room was that it was easy to identify states where there were data collection and reporting mechanism challenges. These were supported to ensure that the processes were put in place at the earliest. With the gradual resumption of economic activities, it was crucial to ensure that gains in the COVID-19 management were not lost. The COVID Command and Control Room played a pivotal role here as well. Detailed data regarding the number of cases, rise in the cases, and rate of doubling enabled the government to identify specific areas, challenges, and undertake cluster containment and quarantine.
The COVID control room had proven itself to be of immense help in our fight against COVID. But the fight wasn't over, and neither was the contribution of the COVID control room. We had to think about what next. How else can it help in this fight? What else can we do with this ongoing approach of data first, utilizing the available infrastructure in the control room?
Leveraging the learnings of using vast and diverse data for policy, the COVID Command and Control Room added another essential approach for the future. It designed in-house forecasting tools for infrastructure and case projections, which allowed districts and states to estimate future caseload and infrastructure requirements. This was an invaluable tool for efficient decision-making, utilization of resources, and a faster response time. The number of cases had finally started falling, and India had managed to weather the storm with a much lower cases per million and deaths per million as compared to various other developed nations. Continuing its proactive stance, India began to roll out the world's largest vaccination program on 16th January 2021. The COVID Command and Control Room team provided technical and functional support in the development of India's end-to-end vaccine management platform, CoWIN, which has been instrumental in the vaccination drive. Following its mandate of data aggregation, indexing and analysis, 9 COVID-related health applications were also integrated with the existing COVID-19 India portal, making it the one-stop solution for all aspects of COVID-19 management as part of the control room. Despite enforcement of public health and social measures, the number of cases started rising again in April 2021. A major point of concern was that this time around, the virus was spreading to rural areas, a region which was not impacted hugely during the first wave.
India had always been proactive and preemptive in its fights against COVID. We had strict guidelines, quarantine and physical distancing protocols. We were one of the first to roll out the vaccine in the world. One of the most surprising and challenging sides of the spread of the virus in April 2021 was the unexpected and unprecedented spike in demand of medical oxygen across the country.
If India faced a challenge, the COVID Command and Control Room was always there to lend a supporting hand. To tackle logistical challenges, it integrated applications such as ODAS, ODTS and OxyCare for tracking of oxygen devices with the COVID-19 portal. This enabled efficient mobilization and allocation of this resource by comprehensively mapping availability, demand and supply.
The changing outbreak trends demanded continuous augmentation of infrastructure and resources. The control room was equipped with integrated control and command center that was connected with COVID war room across the country to respond to the unimaginable scale of the outbreak.
Another crucial activity undertaken by the control room was engaging the pulse of the nation and fighting any rumors, misconceptions or fake news. Combing through various media outlets, both formal and informal, the control room, through timely inputs and media response, helped in preventing panic, allayed fears and quelled misconceptions. The road for the COVID Command and Control Room did not end with the decline in COVID cases. It had proven its efficacy, shown the path, and paved the way for a more advanced, integrated, data-driven and technology-aided health architecture framework. The National Public Health Observatory can evolve as an essential node in the network of health infrastructure in India. It will enable comprehensive health monitoring, besides functioning as the Health Emergency Operations Center during any health emergency, whether it is a pandemic, natural disaster or a localized outbreak. It is drilled down up to district or facility level and is working towards creating over 150 key performance indicators along with their customized dashboards. COVID-19 was the adversity which fast-tracked India towards the path of a tech-enabled, data-driven, agile, customizable and holistic health architecture, which is now poised to change the face of our health infrastructure and surveillance and response capabilities. The National Public Health Observatory is the face of this change. And not only is it poised to change the very landscape of healthcare in India, but it is also ready to become a model example which can be emulated across the globe to truly transform healthcare service delivery in the coming times.